Ever wondered why benzodiazepines often get a bad rap? Let's delve into that. There are some common misconceptions about benzodiazepines that we need to address, and one of the most prevalent is their association with addiction and misuse. Yes, like any powerful tool, benzodiazepines can be misused, leading to dependence and even addiction. But it's essential to remember that addiction is not an inevitable outcome of using these medications. It's the misuse that leads to such adverse effects. Another misconception is that benzodiazepines are simply tranquilizers or sedatives. While it's true that they can induce relaxation and sleep, this is a gross oversimplification of their potential. Benzodiazepines also have anti-convulsant, muscle relaxant, and amnesic effects, which can be incredibly beneficial in a variety of medical scenarios. Some people also believe that benzodiazepines are a quick fix for anxiety or sleep disorders. This is not entirely accurate. Benzodiazepines can help manage symptoms, but they are not a cure. They work best when used in conjunction with other treatments like cognitive behavioral therapy or lifestyle changes. Yet another misconception is that all benzodiazepines are the same. This could not be further from the truth. Benzodiazepines come in a variety of forms, each with its own unique properties and uses. Some are short-acting while others are long-acting. Some are more potent than others. Understanding these differences is crucial for their appropriate use. Lastly, there is a misconception that benzodiazepines are inherently harmful. This is not the case. When used responsibly and under the guidance of a healthcare professional, benzodiazepines can be a valuable tool in managing a variety of health conditions. They have been used successfully for decades in the treatment of anxiety disorders, sleep disorders, seizures, and more. So it's clear that while benzodiazepines can be misused, they also have important roles in medicine. It is crucial to approach these medications with an open mind, understanding both their potential benefits and risks. As with any medication, education and responsible use are key. Before diving deeper, do we actually know what benzodiazepines are? Benzodiazepines, often shortened to benzos, are a class of psychoactive drugs. Their core chemical structure is the fusion of a benzene ring and a diazepine ring. But let's not get too lost in the chemistry. What's more important is what they do. Benzos are primarily used to treat a range of conditions, including anxiety, insomnia, seizures, and alcohol withdrawal. They work by enhancing the effect of a neurotransmitter in our brains called gamma-aminobutyric acid, or GABA for short. This neurotransmitter inhibits the activity of neurons, acting as the brain's natural nerve-calming agent. When benzos enhance GABA's effect, they effectively turn down the volume on your nervous system. This leads to a decrease in anxiety, a calming effect, and in some cases a hypnotic effect. Now, it's important to note that while benzos can be incredibly effective, they're not a one-size-fits-all solution. They vary greatly in their strength, how quickly they take effect, and how long their effects last. Some, like Xanax, are short-acting and used to manage acute anxiety episodes. Others, like Valium, are long-acting and used to manage chronic anxiety disorders. Moreover, they're not a cure. They manage symptoms, but they don't address the root cause of these disorders. They're typically used in conjunction with other therapies, such as cognitive behavioral therapy, to provide a more holistic approach to treatment. And let's not forget about their role in anesthesia. Some benzos, like midazolam, are used in procedural sedation and induce sleep before surgery. They're quite the multitaskers. But just like any medication, benzos come with their own set of risks and potential side effects, which we'll delve into later in this video. With that understanding, we can now delve into the pharmacology of benzodiazepines. Ever thought pharmacology could be as easy as pie? Well, buckle up. Now let's dive into the pharmacology of benzodiazepines, simplified. Imagine a bustling city with people and vehicles constantly on the move. This city is your brain, and the people and vehicles represent the neurotransmitters, the body's chemical messengers. In this bustling city, there's one neurotransmitter that plays the role of a traffic cop. Its name is gamma-aminobutyric acid, or GABA for short. GABA's job is to slow things down, to keep the city from becoming too chaotic. It does this by binding to special sites on the neurons called GABA-A receptors. When GABA binds to these receptors, it slows down the activity of the neuron, much like a traffic cop calming a busy intersection. Now enter benzodiazepines. Think of them as extra traffic cops dispatched to the busiest intersections. Benzodiazepines work by enhancing the effect of GABA. They bind to a specific site on the GABA-A receptor, which makes GABA even more efficient at slowing down neuronal activity. The result is like having extra traffic cops on duty, keeping the city calm and orderly. This enhanced calming effect of GABA translates into the various therapeutic effects of benzodiazepines. When the activity of the neurons is slowed down, it can lead to sedative effects, helping individuals to relax or sleep. It can also alleviate feelings of anxiety, hence the term anxiolytic. Furthermore, by calming the excessive electrical nerve activity, it can prevent or stop seizures, giving benzodiazepines their anticonvulsant properties. Lastly, by reducing the tension in the muscles, benzodiazepines can act as muscle relaxants. So in essence, benzodiazepines are like extra traffic cops, helping GABA keep the city of the brain calm and orderly. They enhance the calming effect of GABA, leading to their various therapeutic effects such as inducing sleep, reducing anxiety, preventing seizures, and relaxing muscles. So that's the pharmacology of benzodiazepines in a nutshell. Simple, right? Now that we know how they work, where do benzodiazepines really shine in medicine? Well, these versatile medications are often the go-to choice for a number of conditions. Let's delve into some of their common uses. First up, anxiety disorders. Benzodiazepines, with their calming effect on the brain, can be a lifeline for those grappling with conditions like generalized anxiety disorder and panic disorder. These medications help to reduce symptoms and provide much-needed relief. Then, there's insomnia. Picture this: it's late at night, you're staring at the ceiling, unable to shut off your brain and get some sleep. Sound familiar? Benzodiazepines can help. By promoting sleepiness and reducing the time it takes to fall asleep, these medications can be a game changer for those struggling with sleep disorders. Seizures are another area where benzodiazepines shine. Whether it's a full-blown epileptic seizure or a smaller, less severe convulsion, benzodiazepines can help to control these frightening episodes, providing a sense of security for those affected. But that's not all. Benzodiazepines also play a crucial role in the treatment of alcohol withdrawal. Withdrawal symptoms can be severe and potentially life-threatening, but benzodiazepines can help to manage these symptoms, reducing their severity and making the process of detoxification more bearable. Last, but certainly not least, benzodiazepines are commonly used for sedation during surgery. If you've ever had surgery, chances are you've benefited from the calming, sedative effects of these medications. They help to reduce anxiety and promote relaxation, ensuring a smoother surgical experience. So, whether it's calming the nerves of a patient with an anxiety disorder, helping an insomniac get a good night's sleep, controlling seizures, aiding in alcohol withdrawal, or ensuring a smooth surgical experience, benzodiazepines have a role to play. As you can see, benzodiazepines have a wide range of uses in the medical field. We've touched on this before, but let's delve deeper into the link between benzodiazepines and addiction. It's crucial to understand that, like many medications, benzodiazepines carry the risk of dependency with prolonged use. This is not an isolated issue, it's a reality that we face with many substances that affect our brain chemistry, and it's something we need to address head-on. Now, when we say dependency, what we're really talking about is a state where the body has become so accustomed to the presence of the drug that it has adjusted its normal functioning around it. This means that when the drug is suddenly removed, the body can struggle to readjust, leading to withdrawal symptoms. In the case of benzodiazepines, these symptoms can include anxiety, restlessness, and in severe cases, seizures. That said, it's important to remember that dependency doesn't mean that a person is addicted in the traditional sense. Addiction implies a compulsive, out-of-control drug use, despite harmful consequences. Dependency, on the other hand, can occur even with appropriate, medically supervised use. This brings us to a critical point: the importance of responsible usage and the role of medical professionals in monitoring use. Benzodiazepines, like any medication, should always be taken as directed by a healthcare provider. These professionals are trained to monitor for signs of dependency and can adjust dosages or suggest alternatives if necessary. Moreover, it's essential to never attempt to stop taking benzodiazepines abruptly or without medical guidance. Doing so can lead to severe withdrawal symptoms and can be dangerous. Instead, a healthcare provider can outline a safe and effective plan to gradually reduce the dosage, thereby minimizing withdrawal symptoms. The bottom line is this: benzodiazepines, like all medications, come with risks. However, these risks can be managed and mitigated through responsible use and medical supervision. While benzodiazepines can lead to dependency, with careful use and medical supervision, they remain a useful tool in healthcare. Misuse of benzodiazepines can lead to serious consequences. But what exactly does misuse mean? Let's dive into this. Misuse refers to the use of these drugs in a manner not directed by a healthcare professional. This might mean taking a higher dose than prescribed, taking the medication more frequently than instructed, or using it for reasons other than those for which it was prescribed. Now let's talk about the risks and consequences of such behavior. First and foremost, misuse of benzodiazepines can lead to addiction. These drugs, when used improperly, can create a physical and psychological dependence that's incredibly challenging to break. It's like being trapped in a cycle where you feel you can't function without the drug, and attempting to stop leads to withdrawal symptoms that can be both physically uncomfortable and emotionally distressing. Additionally, physical harm is another significant risk associated with misuse. Overdosing on benzodiazepines can lead to severe respiratory depression, unconsciousness, and in the most extreme cases, even death. Long-term misuse can also lead to a myriad of health issues including memory problems, muscular weakness, and liver damage. Lastly, let's not forget the mental health implications. Benzodiazepines are often prescribed for anxiety disorders, but irony of ironies, misuse can lead to heightened anxiety, depression, and even suicidal thoughts. Prolonged misuse can also result in cognitive impairment, creating a foggy state of mind where clear thinking and decision-making become challenging. It's crucial to understand that benzodiazepines are not inherently evil. They have proven therapeutic benefits when used correctly. But like a double-edged sword, they can cause great harm when misused. So, where does this leave us? It serves as a reminder that these are potent medications, and their use should always be under the guidance and supervision of a healthcare professional. It's not a matter of scaring you away from them, but rather emphasizing the importance of their responsible use. Misuse of benzodiazepines is dangerous and can lead to severe outcomes, emphasizing the necessity of responsible use. Let's wrap up everything we've learned about benzodiazepines. We started by debunking a common misconception that benzodiazepines are a form of recreational drug. We clarified that benzodiazepines, often abbreviated as benzos, are actually a category of drugs, used primarily in the field of medicine. They are prescription medications, meaning they are meant to be used under the supervision of healthcare professionals. We then delved into what exactly benzodiazepines are. We learned that they are a class of psychoactive drugs with their primary action being the enhancement of the neurotransmitter GABA at the GABA receptor. This results in sedative, hypnotic, anxiolytic, and muscle relaxant properties. These effects make benzodiazepines valuable tools in managing conditions such as anxiety, insomnia, seizures, and muscle spasms. Next, we took a simplified look at the pharmacology of benzodiazepines. We discovered that these drugs work by increasing the efficiency of a natural brain chemical, GABA, to decrease the excitability of neurons, reducing communication between them. This action dampens various physical and mental processes, providing the calming, sedative effects associated with benzodiazepine use. We moved on to discuss the common uses of benzodiazepines in the medical field. We highlighted that these drugs are often used to treat a variety of conditions, including anxiety disorders, panic disorders, insomnia, seizures, and alcohol withdrawal symptoms. We underscored the importance of using these medications as prescribed by a medical professional to ensure their effectiveness and safety. Then we brought to light the truth about benzodiazepines, that while they can be incredibly beneficial for those who need them, they are not without their risks. We emphasized that these medications should not be taken lightly. Prolonged use or misuse can lead to tolerance, dependency, and withdrawal symptoms, which can be severe. Finally, we explored the risks and consequences of benzodiazepine misuse and addiction. We learned that misuse of these drugs can lead to a host of health problems, including cognitive impairment, physical dependence, and even overdose. We stressed the importance of recognizing the signs of misuse and seeking help if needed. And so this journey through the world of benzodiazepines has shown us that while they are powerful and beneficial tools in medicine, they must be used with caution. It's essential to understand their pharmacology, their uses, and the potential risks associated with them. And there you have it, a comprehensive yet easy to understand overview of benzodiazepines. Remember, knowledge is the first step towards responsible use.